of all of the calls that we've heard on the Labor side, 80 to 90% of them have been talking about things that happened 18 years ago, and it's a huge compliment to the government and this Minister of Health that not a single bad word could be found to say about what's been happening over the last 18 months. Mr Lees-Galloway did try, but I'm afraid it was a pretty weak attempt. Mr Speaker, about 18 months before the 2008 general election, the opposition spokesman for health went around the country listening, sharing and discussing matters relating to health issues that informed the National Party's policy going into that election. And I was the Chief Executive of a surgical hospital and President of the Private Surgical Hospitals Association. So I was in the unusual position of submitting to that process that informed the party's policy and then being part of the government charged with delivering on National's commitment to provide better, sooner and more convenient services. And I think the Minister was expecting a bit of a diatribe on the issues facing the private sector, but actually we didn't spend much time at all on that. We focused almost entirely on the issues facing our public system. And we agreed on just about all things. Retention strategies for our young doctors and nurses, improving primary care, less bureaucracy, and let's remember, bureaucracy, DHB managers and administrators went up by 50% under the term of the last Labor government. More elective surgery, shorter waiting times, and most importantly, re-engaging clinicians who had become increasingly disenfranchised from the decision-making process as they got wrapped up under layer upon layer of bureaucracy. But there was one thing we didn't really see eye to eye at that time on, and that was on the issue of structural reform. I thought it was needed. The Minister said no. While the structure we had may not have been perfect, the appetite for such reform was very, very low, and what the National-led government needed to do was to deliver and focus on service delivery, not structural reform. And I think that was very much what informed the party's policy, and I'm interested in reflecting on what that policy said. It said we would continue the growth in health spending, we would reduce bureaucracy, we would shorten waiting times, and we would ensure doctors and nurses and other health professionals would have a say on what was going on in their health services. We would improve maternity. We would provide more services to at-risk mums. We would bond doctors and nurses to keep them here for longer. Well, it sounds like a pretty familiar ring, Mr Speaker, because all of those things have been done, and they've been done without a single change in the legislation. So this piece of legislation isn't about major restructure to the health system. It's about some minor adjustments that will continue the government's relentless path towards improving clinical service delivery, and I think the planning frameworks and the collaboration proposals are extremely sound. But the one that I'm really very interested in and encouraged by is the establishment of the Health Quality and Safety Commission, and I'm not sure if it was Ms Dyson or Mr Lees-Galloway who somehow tried to Ms Dyson, who said that that was somehow inconsistent with what the Health and Disability Commissioner was doing. Well, frankly, it's a completely different thing. I see no crossover there, except to the extent that the Health and Disability Commissioner does step in when things go wrong and does have an educative role. This is a much different beast. It's going to continue the really good work that's been going on in our DHBs, and in particular Counties Manukau, who've taken the lead on a number of excellent quality initiatives, and I look forward to that improving and continuing with the Quality and Safety Commission. This is a really good bill, Mr Speaker, and it continues the government's efforts in health service delivery. I commend it to the House.
I call the Honourable Pete